Antibiotics are one of the most prescribed medications, but there's new research out, and it says that urinary tract infections commonly treated with an antibiotic may be best treated with no medicine at all. Dr. Holly Phillips is here and joins us with the latest on that. So
Good morning, everyone.
good to see you, Doctor. What's the study saying?
You know, this was a study out of the University of Amsterdam, and it looked at women who had gone to their doctors with symptoms of early urinary tract infections. So that's like frequency of urination or burning when you go. The doctors recommended that they hold off on antibiotics just for a week. And it turns out a week later, 70% of them were better anyway, and none of them developed serious complications.
Does this have to do in some ways what you think may be an overprescribing of antibiotics?
Very much so. And actually that's become dangerous for us as both as individuals and as a society. There's been a lot of research done recently into two conditions in particular in which antibiotics are really overprescribed. The first is sinusitis. 20% of all antibiotic prescriptions written are for sinusitis, but in 90% of those cases, they're unnecessary.
What is sinusitis?
Sinusitis is an infection of our sinuses. It really causes pain, that sort of stuffy nose, headache, and it can linger on for weeks, but it can be viral, not bacterial.
That's fascinating to me because I think of all of my friends who say I've got a sinus infection, you go to, but I'm on antibiotics, and you're saying in most of those cases it's viral, antibiotics won't help.
Exactly. And there's another case, kids with middle ear infections, kids under 12, they're almost always written a prescription for antibiotics, but the American Academy of Pediatrics is recommending physicians hold off unless there are signs of specific complications.
And Holly, the reason this is bad is because now when we get superbugs, many of us may not be able to treat them. Is that right?
Right. Now, because antibiotics have been so overprescribed, there is this emergence of superbugs that are resistant to everything that's leading to deaths. And also on an individual level, there's no medication you can take that doesn't have side effects like stomach pain or allergic reactions. So the less you can take medications, the better.
All right. Thank you, Dr. Holly Phillips.